All right, so we're going to go ahead and continue on. We're done with upper body. Now we're going to go ahead and move to the lower extremities and your spine. Is that going to be okay?
Sounds good.
All right, so first thing, if you could go ahead and stand up for me. And I'm just going to be checking your knees. And I'm going to be assessing if there's any abnormal bowing of the legs or anything, or any obvious signs of infections or anything wrong with them. All right, so that looks good to me. All right, go ahead. You can go ahead and take a seat now. So I'm going to go ahead and just kind of do sort of the same of what I was doing as earlier. I'm just going to be feeling around, checking the quadriceps tendon here. Just let me know as I'm going down if anything hurts. Cool. All right, I'm going to check inside here and on the outside as well. Same thing. If there's any pain, just let me know.
Sounds good.
All right, so I'm going to move to the back here. All right, very good. Now, if you could go ahead and lay down here for me. I'm just going to be pressing on the outside of your knee here. It's called a little test called the Bellotment test. Basically, if there is some kind of a fusion in your knee, I'm going to be feeling that on the opposite side here. It all feels good, so you can go ahead and sit up for me. All right, well, actually, I lied to you. If you could lay back down. Yeah, I lied to you. If you could lay back down for me. And if you could go ahead and extend your legs for me. And then if you could bring this leg, try to touch this heel to your butt here for me. All right, and then back out. All right, very good. And now you can sit back up. And then if you could actually go ahead and stand for me. I'm going to be just checking your ankles and your feet, checking the arches of your feet. Move around to the back side as well. All right, very good. You can go ahead and take a seat again. All right, so I'm going to go ahead and start feeling around again on your ankle. So I'm going to start here in the anterior portion of your ankle. And once again, if there's any pain, just let me know. Okay. I'll move to the medial malleolus here. Then the lateral malleolus. I'm going to check the calcaneal tendon in the back here. All right, I'll move down to this big toe here. And little toe. Any pain?
Nope.
Okay, very good. So, if you can bring your foot up to the sky for me. All right, very good. And then point it all the way down at the floor. Okay, and then if you could bring this foot that way for me, it's called inversion, and then opposite way, eversion for me. Okay, very good. All right, so I'm going to go ahead and we're done with lower extremity now. We're going to go ahead and move to your spine. So if you could just turn a little bit that way for me. Perfect. So first thing I'm going to do is inspect again. See if there's any masses, any protrusions. See if anything seems out of midline here.
What's a protrusion?
So say if there was a disc or something that was herniated, it would just be kind of sticking out of your skin back here a little bit more than what would be normal.
Okay, that makes sense.
Okay, all looks good. So I'm going to go ahead and start palpating it once again. So we're going to start right here on these big bumps here, the spinous processes of your vertebrae up here. I'm going to feel, once again, any pain, just let me know.
Okay.
Just feeling the trapezius, just feeling these paraspinal muscles as they go down. Nothing there?
Nope.
Okay.
Feels good.
All right. Now, if you could go ahead, touch your head to your chest for me. Okay, and then chin up to the sky. Okay, and now without making sure you don't shrug your shoulders up, try to touch your head to your right shoulder here as far as you can go without shrugging. Okay, good. Now other side. Okay, good. Now if you can just shake your head no for me, just rotate it. Okay, thank you. So I'm gonna go ahead and move to lumbar spine now. So if you can go ahead and stand up for me, and then turn around for me. Yeah, perfect. All right, so I'm just gonna be looking here, seeing if everything is symmetrical, seeing if there's any obvious lesions, infections anywhere. Okay, very good. So I'm gonna go ahead and I'm gonna ask you if you would to bend forward for me here, just kind of hinge at that hip and bend forward a little bit. And this is just something that helps me look for if there's any signs of scoliosis, which I don't see any. All right, you can go ahead and stand up straight again. And so you can go ahead and sit down for me again. So I'm gonna go, and could you turn that way a little bit? Yeah, perfect. All right, so I'm gonna be feeling around again, kind of the same deal. I'm gonna be feeling these paraspinal muscles. All right, and then I'm gonna be pressing down the SI joint. Let's see. Here. Just let me know if either of these hurts.
Feels fine.
Okay. All right. Now, I will need you to go ahead and stand for me again.
No problemo.
And if you could, just kind of bend forward and flex forward. Okay, as far as you can go, as far as you can go. Okay, good. And then go ahead and stand up straight for me. Now, if you could kind of bend backwards as far as, okay, that's good. And then kind of bend laterally for me. So to the right first, or I guess it doesn't matter. All right, and then stand up straight, and then other way. Okay, very good. And let's see. Oh, one last thing, if you could. It's not the most, the lumbar isn't like the most involved as far as rotation, but it is good for me to go ahead and check. So if you could just rotate your torso for me. All right, very good. And then that, you can go ahead and put your shirt back on. That's gonna be all that I need from you, Mr. Waring.
Cool. Thank you very much.
All right, and do you have any questions for me before I leave?
I don't think so.
Okay, all right. Well, we will go ahead and take care of you then.
Awesome. Thank you.